Hi, Dr. Ben Newman. I am a coronavirus molecular biologist, and I'm here to try to answer your questions with as much science as I can bring to the table. Let's go. Next question is from Jackie. Hello again, Jackie. All right. I'm not sure if this has already been asked here, but is there any scientific evidence as to why COVID seems to affect older people and why children seem to be less affected with the virus? Yeah, there is some scientific evidence, but no, I don't think there is a full explanation for all of it yet. I can give you what we have, and the temptation is to say that, yeah, okay, it's just a sort of a steady slope from young to old, and young get few cases and old get lots of cases. But there are also conditions that only the young get, and so they go in the opposite direction. I think we're mostly focused on deaths rather than actual cases. And yeah, you may have two different things. The thing that makes you less susceptible as a child may be totally different from the thing that makes you more susceptible as an older person. And I think we've been mostly looking for the sort of one explanation to fit them all. And yeah, so here we go. What we know so far, and this has actually been out for a while, is that, but there are a few studies now that seem to back it up. You get more of the receptor protein. So the receptor is called ACE2. This is the main receptor. There's a secondary receptor on other cells and various other things they can attach to, but forget about this. Yeah. ACE2 expression in the lung tends to increase with age. So you get more cells that are expressing it, and those cells are expressing more of the protein. So if this is the main factor that gets the virus into the cells, and if there are lots of viruses crowded around trying to find a cell to infect, which is what we think is the case, then having more, basically more doors you can open into cells would lead to a greater spread of the infection. And then potentially it's just you're starting off at a worse stage. You're starting off with more virus when your immune system actually turns on and kicks in and starts rolling. That's the idea. Children have slightly lower amounts, but they still do express ACE2 protein. I have seen some data, though not as strong, that the other protein that's involved in entry, called TMPRSS2, also works kind of like that, in that there's more in old people, less in younger people. And so together, this would say, yeah, okay, maybe it's easier to infect old people. But the disease itself is mostly an immunopathy, at least as I understand it. It's kind of an uncontrolled, what they call inflammatory response. It's a set of your white blood cells called macrophages, and we're super oversimplifying here, but those are responding in the wrong way and are not being turned off by other cells of the immune system that normally regulate those. There are regulatory macrophages, there are a bunch of other. The immune system is gigantic. It's got all these different cells with names. Oh my gosh, yeah. it's I'm trying to teach the course right now, and yeah, I do my best. But man, is it a hard subject. And so I think it may be a little bit more to do with the way that these different cells work. And I think perhaps some of the pathways that would lead to regulate these cells. And I'm not sure which pathways we're talking about. I haven't seen a real clear explanation based on experimental science yet. There are a lot of speculations, things that could be right, but I want something a little bit firmer to build my house on, if you like. um, I suspect it's going to be something to do with the way that cells signal to regulate these macrophages, and whether we're making less of the signal, whether the macrophages are less able to receive the signal, or whether after they receive it, they're less able to respond to that signal, or whether some other factor that's controlling all of these, something like some epithelial cells or something like that, whether their signaling that should be kind of driving all these processes is getting messed up. There are a lot of possibilities, and I know a lot of people are trying to explore this, but it is a very, very complicated, intricate kind of problem. And of course, we all start off a little different. Even as babies, we have different genetics and slightly different ways that the immune system is going to respond. And as we age, yeah, things will get even more. They'll just spread out a little further, I think. So, yeah, it's a difficult problem. I don't have any more of an answer for you than that. All I can say is that I find that answer probably a little bit easy, and it is probably not the full answer. It does not feel like enough because you're talking a small increase in one protein that does sort of go up with age, but the small increase isn't enough to explain the big difference in death rates and severe illness rates, I don't think. So there's more to the story, and yeah, you just got to keep reading those journals. Well, maybe I've got to keep reading those journals, and eventually somebody's going to hit on it, and they're going to figure it out. So I'm waiting for that. That's going to be a good paper. And yeah, until then, yeah, keep your mind open. And yeah, we definitely do not have all the answers, but at least we're looking for them. That's what science is. So thanks very much. This has been Ask Dr. Ben.